Again, it is such a privilege to have the Lieutenant Governor with us today. When I went through the confirmation process, and people always say, well, gosh, that can't be any fun, but I found it incredibly helpful to meet each senator, at that time Senator Kehoe, and I'll never forget something he told me. We were having a conversation, and as you know, in addition to his service for many years to the people of Missouri, he's also been a small business owner and a farmer. And he said, Randall, you know, prevention is so important to me. He said, I'm in the car business, and I happen to drive the kind of car he sells. And he said, it's just like your car. You know, you change your oil, you change the tires, you do all those things for prevention because you know in your mind that your car will last longer and have value. And he said, I've always thought that analogy just shouldn't be that much different for healthcare, that we ought to really emphasize prevention. And I have used that example more than once, is that we all kind of routinely know that we need to do preventive maintenance on our cars, but sometimes from a public health perspective, we're not as good about doing that for our own bodies. And then the second thing is that literally within 2 days of becoming the Lieutenant Governor, I looked out in my parking lot and I said, that's funny, that guy looks just like Lieutenant Governor Kehoe. And all of a sudden, into my office, he walks. And he just came in and said, I don't know if you heard. I said, I've just been appointed Lieutenant Governor, and I just want to come out and see how you're doing and make sure that I'm available if you need me. And so, you know, those two things just endear him, and the state of Missouri is just so fortunate to have him as our Lieutenant Governor, and we greatly thank him. Please stand with me if you would and just thank him for coming.
Am I using this thing or this thing? Talk. You know how I might get a podium, I like to walk around a little bit. All right, Mike Break, you can sell it. Dr. Randall, you could say Ford. You can say that name around here. People know. Many people know that was the business I'm in. Well, thank you for being here. It was very kind. I never feel well when people stand and applause, so you embarrassed me right off the get-go, so I appreciate that. I wanted to I have a proclamation from the governor that I'm going to talk about just a little bit, but I wanted to thank you for getting together today to talk about things that are so incredibly important to our state and our communities, that you both represent both of those entities. Because as Dr. Williams said, I do believe that prevention goes a long way. And by the way, you don't always replace your tires. Sometimes you just rotate those tires. So it gets a little expensive. You got to replace them all the time. But it's a little bit of a stretch of analogy, but you know, it's not far off. And I won't take credit for it. My dentist is the one who uses that on people all the time. So certainly oral hygiene has maintenance issues to it as well. But I wanted to just thank you for being together and just talk for just a few minutes about the governor's priorities and how it might relate to what you do in your everyday jobs in your community and are for the state. As you know, the governor's priorities are workforce development and infrastructure. And you all might be sitting here thinking, I have no idea how that happens. What does this guy think how that plays a role in my life? But it does play a role in your life. And I wanted to talk about that just for a second. I will start off by saying that being in the position that I'm in, many of you in this room know me. We've met before, and some we've never met. But I'm originally from North City, St. Louis. I've been in Jefferson City about 30 years. And where I grew up, you probably wouldn't want to go back to unless you had an armored vehicle of some sort. It's a rough neighborhood, but we had a great childhood. But if you go from there to Governor Parson calling me last June and asking me to take the role on of Lieutenant Governor, it's a pretty humbling experience. And I will tell you, it's very humbling to be in this job, and it's never a day that I don't take it for granted that serving Missourians is the right thing that Mike Parson wants to do. It's the right thing that I want to do with him. And it's something that I'm just grateful for, that I had the opportunity to work with any group, including y'all, as we go forward here in Missouri. A couple of things before we talk about the economic development, and there's my name falling already. It's time to go. Before we talk about infrastructure and workforce development, one of the things as I was reading the proclamation that the governor has prepared for you is disasters in our state. And I know many of you are from the area or close to the area that many people think of the most recent large-scale disaster down in Joplin. But we certainly had floods since then. We prepare, just about every day we start thinking about, what kind of earthquake could come. And I am serving as the chairman of the School Safety Task Force for the governor. And it's a task force that's put together just several people. We're in the listening process. We're going all around the state listening to people and what their ideas are. Some people think school safety, and the first thing that comes to their mind is say, well, you're covering school shootings. Well, that is part of school safety, but we're covering from the minute the student gets on the bus to the minute the student gets off the bus, and everything in between. So that can be transit safety. It certainly can be building safety when those students are in the building. And does that mean a shooter environment? Unfortunately, yes, that's something we want to hear what people are doing and try to get best practices out there. But it also is natural disasters. And the folks in this room are the people who will come together when Missouri needs us, no matter what part of the state you're from. I know that you do that. I know that you train for that. And I just want to tell you how much we appreciate that, because it's a vital part. Whether a disaster affects a school or a hospital or just a row of houses, it is a disaster. It is unfortunate, and it is a time when we need to come together. And I just wanted to point out that whatever preparation you're doing, you've gone through, and you continue to do for when we have an unfortunate disaster like that, I just want to tell you I appreciate it very much, and it's time well spent, and I encourage you to continue doing that. Just a little bit about workforce development. As Dr. Williams said, I am a small business owner by trade, not a politician. So one I'm a little bit better at than the other. I'll let you guess which one that is. But so I've been doing this about 8 years in politics, but 35 years as a small business owner. And I don't care if you're an employer with 2 people, 200, or 2,200. Workforce wellness is something that employers are taking very seriously every day, more and more, and they're understanding the benefits of it. One, the insurance company, right? The insurance world is kind of driving that to the workplace. Whether you're a public sector employee or a private sector employee, everybody is understanding what wellness means to your employees and what a good workforce is all about. But as we go out and talk to companies across this state on how they might expand, and companies who aren't in Missouri yet, that's usually one of their first questions. What is Missouri doing for workforce readiness and workforce health? Because what you don't want to do is come to an atmosphere or expand into an environment, if you're an existing business, where we don't have a good grab on what we're doing for workplace health. And it starts all the way with the kids, because as you know, and I can tell you as an employer, multiple times, it always told me we were the nice employee and whoever the spouse's employer was a mean employee, because the spouse would call me and say, I can't come in today, boss, because my son or daughter's sick, and my husband or wife will lose their job if they don't come in. I'm like, dang, we must be too nice to these people, but I'm just kidding you. But as you know, when you start talking about the health of children, and I know some of it's very cultural. Trust me, I came from North City, St. Louis. I understand that there's some cultural issues with trying to make sure we get kids taken care of. But if you start with just a children's health and you talk about how that plays a role in workforce development, that probably plays one of the key roles. Because most adults, they don't want to call in sick all the time. They want to be there. They have bills to pay, right? They have things that they have to get doing. They have relationships with their coworkers. They know people are depending on them. But when one of their children gets sick, that's where they, draw the line and say, I got to take care of my kid. And quite frankly, I don't blame them. My mom, I was raised by a single parent, 6 kids, youngest of 6. So we had no other spouse. My mom was not able to rely on my father to do that. And so we had, some tough times when she had to make some decision. It was the last thing she wanted to do is call into her job, which she desperately needed, and say she couldn't be there because one of her 6 kids were sick. So at a very early age, because of out of necessity, my mother taught us that we need to make sure we're taking care of ourselves, because she couldn't afford us to be sick because she couldn't afford to miss days. So when you talk about workforce development, it really starts at that earliest time period. It starts really with the family and the children, and you guys play a critical role in that. But I wanted to talk about one other thing in the workforce development and what you're talking about. And we're starting to hear more people have this conversation, but for almost all of my adult life, nobody talked about mental health. And mental health is just so important in our society today. When I mentioned the school safety meetings that we're having, so we have Department of Health on our school safety panel, because it is just so important to understand what's happening with some of these kids when they come to school, whether that triggers them to be an incredibly violent person or just be a bully or whatever it is. Mental health is something that we as a society just have not been able to talk about. And I can tell you, I have family members in my immediate family that suffer from this, and nobody ever wants to talk about it. They don't want to talk about it. The most parents or friends of mine or other family members I know where there's mental health issues, they don't want to talk, but nobody wants to talk about it. And it's not the easiest thing to talk about. So, it's not like I have a broken arm, I'm going to the doctor to get my arm fixed. That's something everybody says we understand. It's just so hard to get your arms around too. So any way that we can collaborate and figure out together with each other, with the people in this room, where we can make that conversation a little bit easier. I don't know if that's the right term or not, but a little bit more where people will feel more comfortable reaching out to one of your facilities or staff or somebody that you work with every day. If we can continue to build awareness and let people continue to get help, I think that that would go a long way when we talk about what it takes to have a ready workforce. It's mental health. This plays just such an important role. And you're seeing various resolutions and various things come through the House and Senate where they're trying to continue to recognize mental health awareness and mental health professionals. I just can't tell you how important I see that is. It's not only, like I said, but in school, but in workplace safety, just in the ability for, I know people who have mental health problems and they just can't get up and go to work. And if my grandpa was still alive and my mom still is alive, for those two generations, that was never an excuse. What do you mean you just don't know, your head's not together, you can't come in? That's not, those generations before me would not accept that. And be honest with you, my generation has a little bit of a hard time. So it's getting better, and it will get better because kids are becoming young adults and they're moving in their adulthood, and they've suffered with some of these issues. But I just can't stress, I don't want to leave here without saying we just need to continue to work with each other on how we help people develop on these mental health issues and what awareness we can bring and what tools we can bring to the table that makes somebody who's struggling just feel that much more comfortable to be able to somehow reach out to somebody. Because I do believe, and you guys are the professionals, and I've talked to several folks within your various departments before about this, if somebody will reach out and get help, it's usually a life changer. And so that's the thing I'd love you to figure out, work on, continue to talk about, and understand how important that is when we talk about workforce development. The governor's other priority besides workforce development obviously is infrastructure. And so many people in this room might be thinking, what do health professionals have to do with a highway and a bridge? Well, you have to do with a lot of them because people have to build them, number one. But the other piece of infrastructure is besides just highways and roads, it's utility infrastructure, and specifically it's high-speed internet access. And that's where it directly hits the people in this room head on, because if you start talking about telehealth and things that you could do to try to give tools to other people to find out what they need to do to make themselves better, whether it's a physical problem, whether it's a veteran that needs help, whether whatever that person is, young kids, etc. Over 50% of Missourians do not have access to high-speed internet. And we're one of the worst in the United States as far as access to especially to our rural communities. Now, when you go to the building up the street here and you start talking about internet access, if it's a legislator from a large metropolitan area, Columbia, even Jefferson City, St. Louis, Kansas City, Springfield, they're like, what do you mean you don't have access to high-speed internet? Lots of Missourians, over 50%, don't have access. We have a farm in Pulaski County. We're the last house on the road, and let me tell you something, we have no internet access. My kids don't want to go down there when they have homework due or something like that because they need access. So we see the same thing as it could relate to patients or people that you're providing for, and the governor's very focused on getting that high-speed internet connected across the state. We as a state qualified for massive federal grants through the help of our congressional delegation, bipartisan effort, Democrats and Republicans, by the way, that helped with getting some Reach Across America, Connect America grants, they call it, that Missouri got like 70% of the total money available for the entire United States. One, because we have such a bad system that we need to improve, and B, we had public-private partnerships, people that went together with companies and municipalities, et cetera, to apply for those grants. And then the governor in this year's budget and his state in the House and the Senate has put another $5 million in there to connect and fill those holes where those grants don't fix. So as you know, deploying high-speed internet doesn't happen overnight, but that is something in the infrastructure piece that directly affects everybody in this room, and that we are working very hard and making some progress to get done. I think you'll see that. Our rural co-ops now have the ability, through some legislation we've worked on for the last several years, to go out and do that. As you know, our Missouri's rural co-ops are the ones who figured out how to get electric to that last house on the gravel road, 60 and 70 years ago. So now they have some tools in their toolbox where, in addition to everything I just talked about, our rural electric co-ops are also looking at deploying that as well. It's very important to the governor and I for multiple reasons, whether it's business, whether it's health, whether it's educational opportunities. That is a big part of that infrastructure conversation when you hear that. It's not always just a road or bridge, although that's important, and that's the one you hear the most about. I thought I'd just share a few of those thoughts with you, and then if it's okay, I have a resolution from the governor, a proclamation, actually, Dr. Williams, that I would present on his behalf, if you don't mind. And I'm not going to read the whole thing because you guys have heard these before. There are a lot of whereases. I just wanted to pick out a couple of the whereas, not where. Okay. Whereas the value of a strong public health system in the air we breathe, the water we drink, the food we eat, and where we live, learn, work, and play. And whereas the long-standing partnership between the Missouri Department of Health and Senior Services and each of the state's local public health departments and centers provides a systematic framework for protecting health and keeping people safe. And whereas Missouri's public health system promotes health through extensive efforts and partnerships among a wide range of public and private sectors and partners. I now, therefore, Michael Parson, Governor of the State of Missouri, do hereby commend Missouri's public health system. I thought I would present this proclamation on behalf of the governor to Dr. Williams and to everybody in this room in appreciation of the efforts you're taking to improve health for our Missourians across our great state.